Sometimes teenagers experience significant discomfort in their eyes. Even if it's not the usual conjunctivitis, a combination of eye redness and reduced vision could indicate a different issue. Take, for instance, a 14-year-old boy whose eyesight began to worsen in both eyes about a week ago. He had cloudy vision. Another clinic diagnosed him with infectious keratitis. Then he came to see us. During a refraction test, his right eye appeared normal, but the left eye revealed considerable astigmatism. He also mentioned that he sometimes rubs his eyes. Upon examining his eyes, we found a corneal lesion extending to the central part of his left eye. This is likely the reason for the pronounced astigmatism. Upon closer inspection of his right eye, the cornea appears slightly cloudy, suggesting corneal infiltration. Additionally, we can observe the development of new blood vessels. Now, let's examine his left eye. There shouldn't be any blood vessels in the cornea. But here, where the white part transitions to the black part, there's some white opacity. Within that opacity, you can see blood vessels. These blood vessels have the potential to release fat or other inflammatory substances, which can often result in additional cloudiness. Therefore, we need to determine the underlying cause of this condition. It is unrelated to contact lens use, which can lead to new blood vessel growth in the cornea due to insufficient oxygen. That is not applicable here, and his vision was not impaired. When we examine his eyelids, we can see that they appear to be very rough. Furthermore, you can observe these yellowish spots on the eyelids. These are the openings of the meibomian glands, which are not only quite blocked and rough, but also covered with keratin. This blockage is particularly problematic because it can lead to significant dryness in the eyes. Because the eyelids are constantly in contact with the eyes, the release of a large amount of inflammatory substances from them can indeed lead to inflammation in the cornea. Thus, we observed that the condition of both eyelids was found to be in a very poor state. We used an infrared camera to flip the eyelids and examine the meibomian glands. When we looked at the meibomian glands, we saw that they should appear white, but in this child, they do not. The meibomian glands, which should normally appear white, are almost entirely absent because they have been mostly destroyed. Similarly, on the left side, we observe that most of the glands are missing. When these gland openings become obstructed, the oil cannot be released, which ultimately leads to the deterioration of the glands. Therefore, we utilized IPL treatment to dissolve and remove the blockages. When the glands are severely damaged, the response isn't great. But since the condition had progressed so much at a young age, we chose the most conservative treatment possible. This is called pediatric Keratoconjunctivitis. It's quite a long name, isn't it? This indicates that inflammation affects the eyelids, cornea, and conjunctiva in children simultaneously, highlighting their interconnection. The primary source of this issue is found in the eyelids. This condition is a chronic inflammatory eye disease. The inflammation spreads to surrounding tissues, affecting them too. Redness, light sensitivity, foreign body sensation, inflamed eyelids. In severe cases, the cornea can develop new blood vessels, which can lead to scarring. When left untreated, this condition can considerably impair vision, making recovery a challenging process. Therefore, it is crucial to administer precise treatment, although it may be quite difficult to achieve. The causes include meibomian gland dysfunction and bacterial overgrowth in the area. Typically, the bacteria involved are Staphylococci, which are common skin flora. Conditions like atopic dermatitis are also common. It's crucial to differentiate it from vernal keratoconjunctivitis and bacterial conjunctivitis, especially during the spring season. When managing pediatric blepharokeratoconjunctivitis, the primary objective is to significantly improve the condition of the eyelids, which involves meticulous eyelid hygiene using products such as Blephagel or Ocusoft. It is also essential to judiciously use topical antibiotics or steroids, especially as advised by the specialist, to ensure the best possible outcome. Usually, if an infection is suspected, steroids are avoided and only antibiotics are used, but this often does not lead to improvement. In this situation, since the infection is not the primary concern, it is recommended to use steroids along with antibiotics to support recovery and prevent recurrence. Due to the problematic underlying environment, it is essential to make concerted efforts to improve it. Therefore, it is advisable to maintain clean eyelids and, if necessary, consider the use of IPL treatment as part of the regimen. Additionally, a condition to differentiate from is flictenular keratoconjunctivitis. This condition is an inflammatory reaction of the conjunctiva caused by hypersensitivity to bacterial antigens. The symptoms are quite similar, but in this case, the conjunctiva tends to become overgrown. The causes are also quite alike. In this case, it's more about an excessive immune response to normal skin bacteria rather than an issue with the eyelids. The treatment generally includes the use of topical steroids and antibiotics. The treatment is similar because it can greatly impact vision. Proper diagnosis and treatment are crucial. In severe cases, oral medication may be required. There are also treatments, like antibiotics, that can improve the functionality of the eyelids. After multiple IPL treatments, the corneal infiltration has improved a lot. We also used steroids appropriately. There was also a condition known as Dellen, where the cornea experienced erosion. However, it has significantly improved now, as you can observe. As a result, the eyelids have improved a lot. The blepharitis is also getting better. With this treatment, noticeable improvements become evident over time. However, neglecting the condition at any point can lead to a setback. Stay persistent through the challenging phases and you will see substantial progress. So, do not lose hope and keep up with the treatment. Since the diagnosis can be quite challenging, it's crucial to get an accurate diagnosis.